Hi guys, I'm here to tell you what a high blood sugar feels like, also known as hyperglycemia. Like I've mentioned in my past videos, I've been a type 1 diabetic for over 29 years. And the same as with a low blood sugar, that my symptoms have changed throughout my diabetes. The same thing has been happening with my high blood sugar symptoms. When I was first initially diagnosed, my symptoms of high blood sugar were very strong, and I knew immediately when my sugar was high. I would have extreme thirstiness, sluggishness, a little bit of moodiness, and tiredness. And when I say tiredness, this is a symptom I still have to this day. To explain to someone, let's say, who's non-diabetic, it's not tiredness like overexerting your body tiredness, when you've had a long day or a long workout and you're just extremely tired. When our blood sugar is high, it's not that kind of tired. It's a feeling that our eyes are almost too big for the socket. Our eyes actually feel like they're expanding and they dry out. So it causes a heaviness in our eyelids and just kind of forces our eyelids to shut and creates that tiredness. So like I said, my symptoms have changed since I was first diagnosed. Right now, at this point, at 29 years with it, I can walk around with a high blood sugar of even 400 and not know it. And then there are days when I'm 400 and I do feel it. The thirstiness has definitely disappeared as a symptom for me. It's not as strong as it used to be. It's maybe 1 out of 10 times it's one of my symptoms. The heaviness in the eyes is a little more dominant than the thirstiness. The moodiness is definitely still a symptom, but again, not as bad as when I was first diagnosed, and the sluggishness. But I definitely do not feel a high blood sugar that much. So again, I had mentioned, I do wear a sensor. I don't rely on the sensor per se to say my blood sugar is high, but there are days when it alerts me that my sugar is high, and I'm walking around and I don't even realize it. Now, something that I do feel very strong is when I start to develop ketones or actually start developing into DKA. That is very strong still on me to this day. When doctors say you don't go into DKA that fast, well, I've proven them wrong, and I start developing ketones and start feeling the symptoms of DKA within an hour or hours of not having insulin in my body. For those of you who do not know or have never felt DKA, the symptoms are extreme nausea, a burning in the pit of your stomach, and just a feeling of being really, really sick. I would say the burning in the stomach and the nausea is very strong. I've had that mainly when my pump doesn't work, and for those of you who do have the pump, sometimes depending on what pump you have, it alerts you that there's no insulin delivery, and sometimes it doesn't. So I've had instances where it has alerted me, and then instances where it hasn't, and I found out I've been without insulin for at least an hour to 2 hours, and I definitely start developing the nausea and the stomach pain after an hour. So to treat DKA, for those of you who don't know, is to immediately administer insulin. And the best way to do that is not to rely on your pump at that point, because again, you don't know if it's actually going in, but to use a syringe and to get the insulin in there. And when you are in DKA, we are supposed to, depending on how bad the DKA is or how high the ketones are, you're supposed to actually double your insulin intake. So if I were to usually correct with 2 units, I would have to correct the beginning of DKA or the beginning of ketones with 4 units to drop it down. Also, you want to stay really hydrated when you start developing ketones. And they also say a lot of salt. So when I feel that extreme burning and extreme nausea when I'm in that state, I actually drink like chicken broth or beef broth, because it has a lot of sodium, and it tends to help that feeling of sickness go away, and it actually replenishes your sodium levels in your body. So I drink between that and water. I've saved myself a couple trips to the hospital. Again, if you feel like your ketones are very high and you feel extreme DKA, don't rely on just drinking chicken broth and water, and if you still don't feel good, take yourself to the emergency room. Especially if you start vomiting with the ketones. And that's about it, guys. So that's my feeling of a high blood sugar. What I'd love to hear your comments if you have any other different symptoms or any other feelings. Okay, take care. Bye.